Hello, in this video I'm going to be talking about a complication of breast cancer surgery called cording. And I'll also talk about Mondor's disease, which is pretty much the same thing. So what is cording? Cording is a syndrome that can happen under the armpit after breast cancer surgery, and we also see this sometimes after chemotherapy as well. It can develop weeks or even months after disruption of the armpit blood vessels. And basically this is thrombophlebitis, or basically swelling of the vein after instrumentation, like surgery. Before I go on, I'd love to invite you to our channel. We put videos out several times a month, and we do this in response to your comments and questions. So that's a little note to you. If you have something you'd like us to cover you don't see on our channel, let us know in the comments, and we'll make a video on it just as soon as we can. Okay, so back to cording. How does it show up? How do you know if you have cording? Cording is characterized by, you basically feel bumps along your skin, and it follows the line of a vein. So it doesn't go side to side, it goes up and down, and it feels like it starts at the top of the armpit. If you were to raise your hands, it feels like it starts here. It can make it difficult for you to raise your arm. You can have pain. It tends to come on acutely. So you're fine one day, and then later in the week you start to notice this discomfort with raising your arm. It feels really inflamed and tight. This is not a serious condition long term, but it's serious if you have it right now. The way it's diagnosed, if there's any doubt, is with an ultrasound, which would show that there's a blood clot and that the vein blood isn't moving. Now that sounds scary if the blood isn't moving in your vein. It's actually okay because we've got a lot of other veins that can lead to, it can do sort of a bypass, like a detour. When you go driving and there's a detour in the road and you work your way around it, the venous system is like that. The arterial system, the side that supplies blood to areas, cannot have an interruption. But the veins can have an interruption without much trouble. And unlike a deep vein thrombosis in your leg or pelvis, these don't spread to the lung. They don't embolize. So they're uncomfortable, and you may end up being given, seeing your doctor for it and being given non-steroidal anti-inflammatory drugs and maybe some stretching and maybe some warm soaks. But the long-term effects are not serious. This does tend to resolve all on its own. So what causes cording? Well, under the armpit after surgery, it's related to surgery, and it may be, as I said before, related to chemotherapy as well. Basically, think about anything done locally to that area as being vulnerable to disruption. So when lymph nodes are removed, the lymphatic channels are disrupted. Now they can recover. The blood supply, not the arterial supply, but the side that drains the arm, the venous side, can also be irritated. And this is why we can see it after chemotherapy, because anything we put in our body, whether it's tobacco smoke and all the carcinogens or chemotherapy, can irritate the veins and lead to this thrombophlebitis, inflammation of the vein. So those are the things that can cause it, and then just your body's normal inflammatory response as it tries to repair after surgery. I find it interesting that it can occur weeks or months after surgery. You're sort of like your body's saying, oh wait, something happened to me a while ago and I'm just noticing it now. So that's why the timing is not immediately after surgery. I hope this is helpful. Hey, if you've had cording or Mondor's disease, drop a comment in the chat. Let us know how you managed it, how long it lasted. You're helping other people who have the same questions and maybe going through the same thing. Thanks as always for watching, and we'll see you next time.